Welcome back to the Blueprint Nursing YouTube channel. My name is Abby, and today we'll be discussing a helpful tool if you ever encounter a client with burns when you're working as a registered nurse. This tool is the Rule of Nines. Let's jump into it. The Rule of Nines is a helpful tool to estimate the percentage of body surface area affected by burns in adults. This is a great resource for nurses and other healthcare providers to be able to quickly assess the extent of a client's burns. In turn, this helps us to provide rapid intervention, treatment, and predict outcomes. So how does it work? The Rule of Nines looks like this. The head and neck make up 9% of the body surface area. Each arm is also 9%, 18% if both arms are burned. Each leg is 18%, 36% if both legs are burned. The anterior trunk and posterior trunk are each 18%. And genitalia makes up 1%. All of these percentages add up to 100% covering the entire body surface area. This number becomes very important to calculate fluid resuscitation when treating burns. Remember the Parkland formula? Comment down below if you'd like to see more videos about treating burn injuries. An important factor to keep in mind when using the Rule of Nines is that it is primarily used for adults and older children. There is a modified rule for infants and young children due to the difference in their body proportions compared to adults. Also keep in mind that this rule is just an estimate. It may not be completely accurate in cases with irregularly shaped burns or burns involving the hands, feet, and joints. If you have a smaller burn, you can use the Palmer method. This is where the client's hand equals 1%, and that's used to estimate the size of the burn. All right, time for a practice question. We'll have you practice using this tool so you can feel more confident when working through your NCLEX exam and when you become a real deal registered nurse. A client arrives to the emergency department after sustaining burns from a kitchen fire. The client's entire anterior trunk, both legs, and the entire right arm have been affected. Using the Rule of Nines, what percentage of the client's body surface area has been affected? 1, 36%, 2, 50%, 3, 63%, or 4, 84%. Pause the video, review the answer choices, then press play when you're ready to review. All right, now that you've had a moment, let's work through this together. We know the entire anterior trunk makes up 18% of total body surface area. From there, we can see that both legs have been affected. 9% for the front and 9% for the back for one leg is 18%. And both legs are involved, so 18% plus 18% equals 36% for the legs. Then last, the client's entire right arm, which is an additional 9%. So, if we add 18% from the trunk, plus 36% for the legs, plus 9% for the arm, that gives us a total of 63%. So, our correct answer is number 3. Great work. Here are our references. Thank you so much for reviewing the Rule of Nines with me today. Don't forget to subscribe so you never miss a video. If you have any topics you'd like to see covered, leave them in a comment down below. And don't forget to check out Blueprint Nursing's TikTok for live study sessions, crash course, and live study group options to help you feel most prepared for your NCLEX. See you next time.